Good evening and welcome to our annual DoctHERS Symposium. I am Rose Birkin, class of 1992. Yes, that long. Clinical assistant professor of anesthesiology, former president of Jacobs School of Medicine Medical Alumni Association, and a proud co-founder of DoctHERS Network. On behalf of the network and committee, I'm thrilled to share the role as moderator with our doctors members and second-year medical students, Courtney Vaughn and Kelsey McIntyre, who will assist me in introducing our speakers this evening, and our committee members who will assist in facilitating our networking in the breakout sessions. I am most impressed with the large number of women participating tonight. Feel free to take a moment and scan the gallery of attendees. Notice the variety of backgrounds in healthcare, the military, law, business administration, education, and more. Alumni, faculty, friends, and students are joining us from India, Turkey, Canada, and 12 states tonight. We also have our leading female deans in health sciences from UB, whom I would like to acknowledge and welcome. Dean Marsha Lewis from the School of Nursing, Dean Nancy Smythe from the School of Social Work, and Dean Jean Watkowski-Wendy from the School of Public Health and Health Professions. We invite everyone to introduce themselves, let us know where you're from, as well as ask questions to our panel using the chat box throughout our program. It looks like we already have a good chat going on, so keep it going. Before we begin, we felt it was important to honor a recent graduate, fellow DoctHERS member and remarkable young physician, Dr. Adeline Fagan, class of 2019. She passed away on September 19th due to COVID-19 complications while in her second year of residency in Texas. Dr. Fagan was hospitalized with COVID-19 after she started a rotation in the emergency department. She appeared to be on the road of recovery until suffering a massive brain bleed. To quote Dr. Doreen Marshall, Associate Dean and Director of Medical Admissions, Adeline was a bright spot in an often dark world, exuberantly joyful, humbled, troubled by the woes of others, and determined to leave this world a better place through her outreach on many fronts. As a medical student, Addie participated in 4 global medicine trips to Haiti. She was the leader of our medical student a cappella group and always found time for family and friends. The Jacobs School created a memorial fund in honor of Dr. Fagan, and we'll share the link following today's meeting. Please join me in celebrating Adeline's life with a moment of silence. This year looks much different for all of us. The COVID-19 pandemic has caused us to think in ways we never expected, has forced us further out of our comfort zone, yet has encouraged us to stay connected in new virtual ways. This is our first virtual symposium, and whether you are returning DoctHERS Network member or new to our group, we're sending our thoughts and well wishes to you and your family to stay well and safe during this challenging time. Our symposium's theme is A Time to Be Bold, Women at the Forefront of Change, which we hope leaves you inspired and remaining hopeful for female leaders of today, as well as our future in healthcare. Whether you're a physician, nurse, dentist, pharmacist, scientist, faculty member, resident, student, CEO, parent, we created the DoctHERS Network as a way to advise, support, and mentor, while providing a platform to share the highs, challenges, and experience of our careers. After our program this evening, we will continue the conversation with each speaker and encourage you to participate in one of the 3 breakout sessions to give you a DoctHERS networking experience. Ask questions, share your stories, and leave tonight a bolder version of you. Tonight, we are honored to have 3 leading women in our community. Dr. Gale Burstein, Rear Admiral Rebecca McCormick-Boyle, and Dr. Ashley Jeanlus, sharing their stories with us. We respect and admire all you have done and continue to do for our community. To thank you, as well as all our healthcare heroes, this video was made with you in mind. Please enjoy.
Hi, my name is Joanna, and I'm one of the DoctHERS student co-chairs. On behalf of the medical students, we would like to thank all healthcare workers for your unwavering dedication to healing others and for your incredible leadership during this unprecedented time. You are all true heroes. Thank you.
Hi, UB alumni. As a medical student here at the Jacobs School, I just wanted to say thank you so much for modeling the strength and selflessness that I hope to emulate one day as a physician. Your sacrifice is greatly appreciated, and your community here with the students at the Jacobs School are with you.
Hi, I'm Waylon, and I'm a first-year medical student at UB. I just wanted to leave a message to all the healthcare workers and all the people working on the front lines to say thank you so much for everything that you're doing, keeping our friends and family safe during this crazy time. We really appreciate you and we support you. Stay safe and stay healthy.
My name is Nicole Favor, and I am a second-year medical student and DoctHERS student co-chair. I would like to thank all of the healthcare workers that have worked tirelessly day in and day out to keep our communities healthy. I am inspired by your leadership and continual strength during this unprecedented time. No words can accurately express our appreciation.
Thank you so much for your time, dedication, and strength in navigating this pandemic. I, along with the greater medical student community, am extremely grateful for the work that you and your colleagues are doing now to inform and advance the medical care we can provide in the future. Thank you.
Hello, my name is Courtney Vaughn. I'm a DoctHERS student co-chair. To all the healthcare workers out there, thank you so much for your leadership and sacrifice in the most difficult of circumstances. Your kindness, strength, and commitment to serving our communities does not go unnoticed. Thank you so much for all that you do.
That was a wonderful video. Thank you to all the medical students. What an incredible group of future physicians and future female physician leaders. Thank you all. And now I have the pleasure of introducing our keynote speaker and fellow DoctHERS committee member, Dr. Gale Burstein. After Dr. Burstein, our DoctHERS students will introduce our remaining speakers tonight. We will leave the questions for all speakers for the end of our session and also in the breakout sessions. Dr. Burstein received her medical degree from the Jacobs School of Medicine and Biomedical Sciences and her master's in public health in maternal and child health from Johns Hopkins University's Bloomberg School of Public Health. She is clinical professor of pediatrics in the Jacobs School and research professor at the UB School of Public Health and Health Professions. Dr. Burstein currently serves as commissioner for the Erie County Department of Health. In this capacity, she leads the county's response to the COVID-19 pandemic alongside local government and administers the community health assessment and health improvement plan for Erie County. And she has done a phenomenal job, and we all thank her very much. She also co-leads the opioid task force for the county and spearheads its childhood-led toxicity prevention program. Prior to becoming Commissioner of Health, Dr. Burstein served as Chief of Pediatrics at Chongwe Hospital in South Africa, as a medical officer at the Centers for Disease Control and Prevention, and this is in addition to other clinical research and teaching positions. It is my pleasure and honor to welcome Dr. Gale Burstein.
Thank you. Thank you. And thank you for that warm introduction. My husband always says I look good on paper, so I guess I do. So, I want to say a warm hello, a shout out to all my friends that have joined us tonight. So I can see you, and I'm really excited that you're here. So thank you very much. And I also wanted to let you all know that I am so honored to be the health commissioner in Erie County during this pandemic. It's very humbling. It's a huge responsibility, and I've never worked so hard in my life. But I just consider this part of my job. I mean, I've been training all my life for this, and it's just part of my job. So on the one hand, I think I'm a little bit surprised that I'm honored this way for just doing my job, and I am really grateful. So in this breakout session, I thought I could talk about what the journey has been like during COVID-19. And then later on at 7:00, when we have a smaller group, people want to ask me how I got to be health commissioner in the first place. There's always a story. So there's a story about that if you want to hear about it. So let me start talking about like what my life has been like as a health commissioner in COVID-19. So first, like a big overview of what we're seeing in Erie County. I mean, the county executive and I, Mark Polenkars, we give a press conference now about every 2 weeks time, and we post our data on our website every day. So that I'm not really going to go into details with numbers, but just like a big overview is that since we started counting our numbers in March, we have almost 12,000 unique cases in Erie County of COVID-19, and unfortunately, we've had over 700 deaths. So that's been really sad. And I have to say, we started this journey in March, and in March and April were like really challenging months. Remember everything closed down, and it was just like, really dark, and we were getting like, more and more cases, and we have very high positivity rates and high numbers of hospitalizations. And we thought we were going to run out of hospital beds, and it was just, a really scary time. I mean, there were just, what was really scary is that there were a lot of unknowns. We didn't know a lot about the virus. This is a novel virus, and there wasn't a lot that we know. And, we didn't know what to expect. We didn't know the natural history. We didn't know much about transmission. And, most people in New York State, the governor ordered everybody to go home, close down, and everybody went home. But I went to work every single day, like 7 days a week. And I was at work like 12, 14 hours a day. I mean, there was a lot of work to do. And so that was kind of scary because we just felt like we were, the message was like, go home, don't go to work, don't be near other people. And like every day I was going to work and being around other people. And it was like really kind of difficult for us to social distance in the beginning. We had to kind of figure out where we could be to be a little bit safer. And also it was scary at that time because remember, at the beginning, there was like really a limited amount of testing. And so like we ever knew was like, oh, is that person positive? We didn't know like who was positive, who could have been infected, like who could I get infected from, again, because we didn't really know much about the transmission and how to prevent it. And it was just a scary time. So fast forward to 8 months later, we're in a much better place. And there's still a lot we don't know. So we're finding out something new every day. So, in the overview, we know this pandemic has taken, a huge toll on our community. I mean, just from an economic standpoint, I mean, people have been financially devastated. They've lost their lives. They've lost their homes. It's really been awful. I mean, we were affected for a short time. My husband's a gastroenterologist, and like he didn't, they weren't working for, for a couple months, and he made the best of it. He went skiing every day, but we still like we didn't. He makes more money than I do, and so that was a part of our income that we didn't have. Also with mental health, there like people were isolated, and some people are still isolated, and that led to depression. We're seeing now is an increase in all types of drug overdoses, but especially opioid related overdoses. So we've gone backwards a lot with this, just because of all the isolation. People aren't seeing the friends that they need. They're not seeing their family members. Like they have older parents that are like locked up in a nursing home, and only now they're starting to be able to see them. So it's been really, really stressful. And then there's been personal losses with deaths. Again, we've had over 700 deaths in our community. And so it's, it's just been, it was a really, really hard time, and many people are still continue to struggle. Also as a pediatrician and a mother, it's very upsetting to see what happened to our educational system, that we didn't really have a choice, but we know that, kids were sent home from school. The quality of education from virtual learning was, iffy, if best. And more importantly, I think kids weren't able to receive the social and emotional support that they needed, that they obtained through school. Kids weren't able to get food. School's a big safety net, identifying kids who are victims of abuse, and that wasn't happening anymore. And there was more stress at home. I mean, we all believe that there is a lot more abuse that was going undetected in our community. And then, kids were like really, really angry. I mean, one of my sons is really angry that he's not back in college, and it's, there's nothing I can do about it. And it's really frustrating. So I'm just going to talk a little bit about, what my job has been like as the Erie County Department of Health Commissioner, and as really kind of being in charge of our COVID-19 response in Erie County. So, we've never lived through a pandemic, fortunately. And, when I think what a lot of people think of pandemics, especially when, I was thinking about a pandemic, it's like an emergency event. It's this event. And when we have events in the past, like, blizzards and they're, most of these events are weather related. And so they have a set onset of time, and then there's more time afterwards, for the response and the recovery. But, there's a limited amount of time, and like this is going on for a long time. So it's it's a different type of response that we've never experienced before. So and it's not only ongoing, it's a growing problem despite all our response efforts. And so we've had different stages of our pandemic, as I alluded to earlier. And each stage, there popped up some like unique challenges that I've never would have ever thought of. I mean, the devil's always in the details. And then, these new problems arose, and figuring out how to address it. And then another problem came up from that. It was, I never really had the opportunity to say, oh, I figured it out, and just, be comfortable. And because once I go home comfortable about what we were doing, and then the next day, like some bomb would explode, and, we'd have to start all over again with addressing another type of crisis. I think one of the biggest challenges for me in this COVID pandemic was communication. I mean, communication is critical, and it's really, I think, one of the more challenging component of our response. I mean, the people are scared. They need information. They need to know. And I need to communicate with the people I work with, both internally and my outside partners. And there's just so much information coming in and going out. It was just really overwhelming. So, we tried to kind of, split it up and piecemeal it. So just to communicate with, the community, people had questions, they were really scared. So we started this information hotline. We still have it now, 716-858-2929. And, people could call in for questions. We start it, and it's still very, very busy, because now it's how people make appointments to get a COVID-19 test from the county. Now that we have these point of care tests, these Abbott ID Nows that we're offering to students who are attending classes in any pre-K to grade 12, and then school staff that are also in the school, we're offering this this test so that people have symptoms, they can get back to school if they know that they're COVID negative. And we're getting like 800 calls, easily 800 calls a day, way over that. And so this is just, the communication is just crazy. Also, we started a website with a lot of information. And again, this information, especially at the beginning, was just like pouring in, and then like having to read it and dissect it and digest it, and then post it on the website in an understandable form was just a daunting task. And so we had a whole team devoted to that. And so now our website, I mean, it's, it's still a government website. It's not like cool, like Google or Facebook or anything like that. But I think it's a good, solid website, and it's a great repository of good COVID-19 information. And we add information on daily from, the feds, from CDC, from the New York State Health Department, and then local information. And then, we started also having these press conferences, if you remember, with the county executive and I. And like initially, these were like press conferences like every single day. It was so draining. I mean, every day having to go on camera with prepared comments about the pandemic and getting updates, and it was really, really draining. And originally we would do this in person with live press, and then we realized we're not social distancing well enough. We're the press has to go away and be virtual. So then we started having daily virtual press conferences. And then, as we kind of started getting to kind of more of a maintenance phase, now they're tapered off to weekly, and now actually they're about every 2 weeks. So, we've been able to kind of dial it down with the press conferences, and then we can always dial it up if, we have another surge. So that's been interesting. Also, just me personally, with the flow of communication was just overwhelming. I mean, I was just getting information from the state, information from my subordinates, information from my, other commissioners, from the county executive, from the state health department, from, hospital partners. It was just overwhelming. And I would get like 200 emails in my email box a day, and I didn't have time to read them. I couldn't even see what was in there because I couldn't figure out what was important. So I couldn't even look at my email during the day, and I had to rely on text. And I'd be getting multiple texts all the time. I mean, my thumbs were gonna fall off. And it was I couldn't even use. Then all of a sudden, after a point, that got overwhelming to be able to communicate by text, because all I was doing is texting. It was it was just really crazy. And I'd spend all day trying to solve problems and planning and with operations and answering questions. And it was just really overwhelming. And I would my husband would force me to come home at 8 o'clock at night, and I would eat dinner with my family. Peter's a great cook, so I never really got to eat during the workday, but he would make me a great dinner at night. And and then 10 o'clock I'd start to chip away at my emails, and I'd be up pretty late, which that's kind of how I am. I'm an owl, not a lark, but it was it was exhausting. And just keeping up with communications, which are essential, is just very, very challenging, something I've never thought of before. And then, we have challenges not only with, communicating with the outside. We had internal communication problems, both, inside the health department and outside the health department within county government. Because all of a sudden, I had to work really closely with other people in county government that didn't know anything about public health, and I didn't know anything about what they did. I mean, we saw the world very, very differently. And these are people from emergency services and the personnel department and elected officials. And it was, it was very different. We weren't used to working with each other. We didn't have the same language. We didn't have the same backgrounds. We didn't have the same understanding of, what were important, what I thought were important priorities. We didn't have the same understanding about confidentiality of, HIPAA protected information. And we had to work really hard, I think, to understand ourselves and explain where we were coming from and to be able to work together. There was a lot of times there was a lot of friction. Some partners were really willing to come to terms on the table, and some partners were very vocal and letting me know that they knew more about my job than I did, and this is the way that I should be doing it, which didn't work very well. So that was a challenge, and it was difficult how to deal with that. I just couldn't tell them what I thought about them, because I was going to have to work with them I still have to work with them. And so I know I couldn't say what I was thinking and alienate them, because I had to figure out how to be PC and how to reel them in, which was a challenge. And there were a lot of power struggles too, like internally, which is just like really frustrating. I think government, as in many worlds, it's still like in kind of an old boys club. That structure still exists. And every day we would have these like leadership calls of our COVID response. And there were about 10 people on the call. 3 were female, the rest were male. And I could tell that it was like the men were like really trying to to lead this operation. It was a little bit frustrating. And we didn't always talk the same way. Like there was we were on one call, and like one of the men was talking about like trying something new, like trying something different. And then he made this joke, which I like totally didn't get. I guess it's a quote from Anchorman. It says 60% of the time it works every time. And then like all the men on the call just like burst out laughing. They were like screaming, laughing. You could hear like coffee like spitting out of their mouth because they thought it was so funny. And I'm like, I don't get it. And I could hear like none of the women on the call got the joke. And like, I guess, yeah, I'd have a Y chromosome to understand that one. And so, and the next day I asked on the call, like, I didn't really understand that joke you all talked about yesterday. And, they told me to watch this movie Anchorman. And I did, and I still didn't think it was funny. It was a little bit crude after I saw the context. But anyway, got to get over it. I have thick skin, that's been my world. So, do I have a few more minutes, or you gonna pull me off with a cane?
Keep going.
Okay. So, getting back to our COVID response in Erie County, I mean, this has really been an all hands on deck operation, especially in the earlier phases. It wasn't just a public health emergency. It was just like a whole disruption of everybody's lives in the county. It was just really scary. I mean, businesses were closed. Governments were closed, government services were closed, schools were closed, restaurants were closed, healthcare systems kind of closed down. It was really tough, and we had to figure out how to make things work in that climate. And I had to form new relationships and work with new partners. And I have to say that like everybody has biases. You have to admit it. And I admit that. And many times with these new relationships, like I came in with biases, and I've been like humbled that I really should not have had those biases coming in. So an example is like all of a sudden, like, we needed like 40 contact tracers, and like we don't have 40 contact people that could 40 people to do contact tracing at the health department. So we had to reach out to other departments in the county, and actually other offices in the county, to to recruit staff to be contact tracers. So I was told that by personnel that I was going to get 20 Erie County sheriffs, like deputies, to work with me. And I was like, at first I'm like, because the jail wasn't very busy. And so they were guards at the jail, and they were going to come over and do contact, help us with case investigation and contact tracing. And like my reflex response was like, oh my God, do they speak in full sentences? I mean, they can't just grunt. I mean, they have to ask questions. And like, shame on me, like our sheriffs that are the deputies that are working with us are like the best contact tracers that we have. Like they're so into it. Like they love investigating these cases, and they ask the right questions, and they have like such a good attitude, and they're the most efficient and, productive contact tracers. And I mean, they're just like really a great crew to work with. And so, I've been humbled by my biases being challenged by real life experience. So, that was nice. And they're also, the sheriffs help us a great deal with our sanitarians when they have to go out and inspect bars and restaurants, especially bars when there are a lot of drunk people that don't want to wear masks and don't want to go home. It's nice having law enforcement there to, to be with them, to, stand behind them when they have to, close up a place or even issue some violations. And then there was another group of partners that I was pleasantly surprised that we're working so well together. And, I was very skeptical and about, some hidden agendas, and with the CMOs of the hospitals wanted to partner with me. And, again, I was, really skeptical that this relationship was work because, medicine, hospital-based medicine is very different than public health. But like now I feel like they're my BFFs. I mean, we worked really well together. They had great suggestions to help us with, addressing our COVID response. And, a lot of them, they really turned out to be heroes and really like going out of their way to behind the scenes to make it work. And so that was, really a pleasant surprise. And, I had some other like unpleasant surprises. I've had, I've actually felt like attacked by, some other elected officials, I think unfairly going after me. And so that's been a little bit difficult. And, nationally, there's been a problem of female public health officials where I've read that, there've been quite a number of, female health department commissioners or, public health directors that felt like they had to quit. They just, it just wasn't worth the risk of their, personal safety to lead that effort. I mean, I haven't been that extreme because our county executive, Mark Poloncarz, have been like super, super supportive and, has really led the way to, I think, a successful COVID response so far. But, there has been some attacks also. I feel like sometimes the media doesn't treat me well and has been unfairly and hasn't really told the story right. And then, there've been challenges working with the schools because, I mean, I know it's like really frustrating for them and, we have to be the enforcement arm and that's been really challenging. So just like briefly, just giving some numbers of where we are with COVID-19. So this past week ending on October 3rd, we had 465 new unique cases. And that's actually an uptick. That's the most cases that we've had since the beginning of September. But on the good side, we had more people tested than usual, more tests done. So our proportion of positive tests was down to 1.3%, where the week before it was 1.6%. The week before that was 1.8%. So we had been coming down. But as a pediatrician, as a mother of two sons in college, I'm very distressed that the age group with the highest proportion of positive tests and the higher numbers of tests are that 5 years to 18 to 22-year-olds. So they make up about a third of all the cases in Erie County is that 18 to 22-year-olds. And so that's been a problem where, most age groups, it's, anywhere from like less than 1% to maybe 2 or 3% of the tests in that age group are positive. Last week there, among the 18 to 22-year-olds, like 5.5% of the tests done in that age group were positive. So that, that's a problem, but, we know what's happening there. The zip codes with the highest number of cases are the zip codes where we see higher ed. Another place where we've seen COVID affecting is in our areas in our community where we see a lot of poverty. So there there's been there are a lot of, and it really highlights kind of the disparities in health that we've experienced with other health conditions. So, although there are only about 28% of our Erie County population lives in the city of Buffalo, the city of Buffalo population accounted for almost 50% of our COVID-19 cases. And we see a much higher proportion of positive tests among people in the city of Buffalo compared to people outside of the city of Buffalo and in Erie County. And you can imagine it's just, it's circumstances, people are living in close quarters. You have multi-generational families where there can be like 10 or 11 people in a house and one person's positive and then everybody gets positive and then they all get tested. And then you have like, a hotspot in a particular address. It's really difficult in that circumstance to isolate and quarantine safely. And also there are cultural barriers too, just like people understanding, what that means and the importance, especially if they're asymptomatic. And so that's we have this hotel where people can stay if they don't have a safe place to isolate and quarantine. And we provide, help people get their medicine. We provide food. And, that's not something that's socially acceptable, especially to our immigrant population, because the government putting them away somewhere is the reason they left their country. And so that's that's been a kind of a challenge there. And also with our mortality data, just in terms of health disparities, we've done a better job with there. Really, the disparity we're seeing there is age. Like almost all our deaths are among our seniors, people 70, 80 and up. And the proportion, we don't see a disparity of COVID-related mortality by race, ethnicity. So about 80% of our Erie County population is white, and about 80% of our COVID-19 deaths have been white. And then about 16% of our Erie County population is classified as Black or African American, and about 15% of our COVID-19 fatalities are Black and African American. So, and that's really from working with our partners, working with a faith-based community, really communicating, and has been, very important to our COVID-19 response. And that hasn't been true in most areas of the country. So lessons learned, just wrapping up. So from COVID-19, so there is no such thing as being too prepared. I've never been, I feel like I'm never prepared enough for these crazy new things. I mean, I go home every day, I'm like, oh my God, that day was so crazy. Tomorrow's not going to be as crazy. And then at the end of the next day, I'm like, God, that day was like crazier. Today was crazier than the day before. Like, how can that happen? And then, you just have to expect that every day you're going to have a surprise. I mean, you just have to just learn just to expect the unexpected. In the fall, we have new strategies that we're working on to as part of our COVID-19 response. We're trying to target these these point clusters. And then also we're doing wastewater testing. We're partnering with UB and with the state to do testing wastewater is for COVID-19 is kind of sentinel surveillance, where you can maybe see some hotspots popping up before we get test results. And then we're also working with our community partners with UB and the CTRC and our hospital partners, planning for, vaccine dispensing. Many of the vaccines in the phase 3 trials are mRNA vaccines, and those have like extreme cold storage requirement, like minus 80 degrees. And so that cold chain is going to be very difficult to maintain. And so we really have to reach out to our partners to do that. And, we have been doing it. So we are starting to plan that. And so, what I think about what's going to happen in the future. So I think this pandemic will eventually come to an end. We're going to come out the other side with losses. However, we're going to come out also with gains. We're going to have new relationships, new way to conduct businesses. Like these virtual conferences are great. They're able to be more inclusive for everybody. Then we're going to have new ways of doing things. People hopefully will stay home when they're sick. They won't come to work and get everybody else sick. And that'll be acceptable. Virtual telehealth will be acceptable. And there are also like a lot of gains that I hope that we've made in order to respond to COVID-19 pandemic that I hope will stick. Just in closing, just want to remind everybody, get a flu vaccine, make sure that everybody in your family gets a flu vaccine and your patients get flu vaccine, and beware of prevention fatigue. And we have to make sure that we stay, steadfast, fighting against misinformation. So thank you.
Thank you so much for your keynote address, Dr. Burstein. As a reminder to everyone, we'll be taking questions for our speakers briefly after the program and in each individual breakout session. Good evening. My name is Courtney Vaughn, and I'm a DoctHERS student co-chair and a second-year medical student at the Jacobs School. Tonight, I have the privilege of introducing Rear Admiral Rebecca McCormick-Boyle. Her distinguished career was 36 years long in the United States Navy's Nurses Corps. McCormick-Boyle made a tremendous difference in the Navy medicine, had many outstanding achievements in quality management, diversity management, and the patient experience, as well as changing the way healthcare is delivered to our service members across the Department of Defense. A fellow in the Academy of American Nursing and a 2019 SUNY honorary doctor recipient, McCormick-Boyle is a 1981 graduate of the University at Buffalo's School of Nursing. Since her time at UB, she has led efforts
to establish Navy medicine's primary care model, playing a pivotal role in the coordination of humanitarian assistance, disaster relief, and contingency support activities, and planning and providing oversight for Navy healthcare and readiness missions by air, by sea, on the battlefield, and in 16 hospitals and 198 clinics. McCormick-Boyle is currently retired from the U.S. Navy Nurses Corps, and in January of 2020 became the Chief Integration Officer for the Catholic Health System. Due to COVID-19 in Western New York, McCormick-Boyle was tasked with in early March with leading the transition of Catholic Health Sisters of Charity Hospital at St. Joseph's campus in the Buffalo suburb of Cheektowaga in New York State's first dedicated COVID-19 treatment facility. The World Health Assembly has designated the year of 2020 as the Year of the Nurse to celebrate Florence Nightingale's 200th birth and to advocate the vital role nurses have in transforming health around the world. As we celebrate the Year of the Nurse, we are thrilled and honored to have Rear Admiral Rebecca McCormick-Boyle here tonight to share her numerous experiences in regard to leadership and response in a time of crisis. Please welcome Rebecca McCormick-Boyle.
Hi, it's good to be with you tonight. I really appreciate the opportunity. And I really appreciate our keynote speakers' comments, and I'm going to have one little quick comment about that. We as healthcare professionals truly are leaders. Our patients come to us, our family comes to us, our community come to us. They come to us for wisdom and they come to us for guidance. The textbook calls leadership influencing others towards goal, but I say wisdom and guidance. Wisdom and guidance, influencing others, this pretty simple definition for something that really is very complex. It's a complex set of tasks that evolves over time. We change, our leadership abilities change every day. Our keynote speaker talked to it. It's situationally dependent, and it's certainly personally dependent. And as much as it's really complex, I do think that there are some very specific basic tenets of leadership that apply to this situation. And I call them 4, but then I'm going to add 2 based on our keynote speaker's comments. And the 4 are: 1, mission clarity; 2, team, unity of the team; 3, concept of operations; and then 4, what I call the leadership sprinkles. And the 2 things that I want to add, though, based on our keynote speaker's comments, are personal resilience. There has to be personal resilience. And then 2, a support system. And clearly our keynote speaker has tremendous personal resilience and a very good support system to be given a good dinner at the end of a long day. So I'm going to go through those 4 items. Mission clarity. So at Catholic Health, we are really blessed to have a tremendous leader in our organization. Mark Sullivan's our CEO. And as COVID evolved and approached and we got wind of it and it was coming, Mark didn't hesitate. Mark leaned into it and prepared. And he was very clear with his leadership group about what we had as a mission. And our mission was to care for as many as our people as possible while taking care of our associates. It was a very clear mission. And he established, then number 2, a leadership team very quickly. And he had a great leadership team at the headquarters. And then for me, he said to me, when he asked me if I would lead the St. Joseph transition, he fully empowered me to pick a great team. And I had a great team, and I'll talk about that in a second. And then concept of operations. Mark had a big, at his level, so again, leadership, this is tearing down. At Mark, I'm telling you, Mark's level and then my level. And at his level, concept of operations, Mark and the leadership team said, what would it be? What would it look like? How would we perform if we took one of our hospitals and we dedicated it to COVID? What would that do for us? Would we be able to take care of more patients? Would we be able to consolidate our critical care resources? Would we be able to take care of our scarce resources? How would that look like? So that was a basic concept of operations. And then the leadership sprinkles, which I'll get to. So how this evolved on Saturday, it was on a Saturday, Mark made the decision, we're going to do this thing. and we're going to close the ER for St. Joe's. So we closed the ER in St. Joe's, and I went to St. Joe's. It was the first time I'd ever been to St. Joe's. So I go to St. Joe's on a Saturday. We decide to close the ER. I meet with his incident command leader to say, who can I have on my team? And as I said, I was empowered to pick who I wanted on the team, but you have to be careful who you want on your team. Collins in the book says you have the right people on the bus. And so I need to figure out what seats I wanted on the bus and what people I wanted on the bus, because you can't have all the voices. Just as our keynote speaker said, there's a lot of voice. It's a lot of cacophony, and you got to neck it down. And so for me, I had to be very particular who I wanted on my bus. So I had medical, I had nursing, I had education, I had logistics, I had IT, I had quality, I had staffing, I had infection control, I had emergency management, and I had ops. And there were other people who wanted to come in, and I said, no, you can't, we'll represent you. So I had to really neck it down and say, this was my team. And so the team was notified on Saturday, please report on Monday morning. On Sunday, I had to gather my thoughts. On Sunday, I had to gather my thoughts to say, okay, what is my military phrase, commander's intent? How do I want to roll this out? How do I want to communicate to these folks and create a team and create clarity on our mission? So I created a presentation. Monday morning, we went over it. So I had to very quickly, with this team of 13 people, establish mission clarity. And it was more refined at that point. We want to take care of as many critical care patients as possible while taking care of our associates. It was very clear, and I had to mention it every single day to our team. Team concept. I had to talk to the team about it, because these were people who had, many of them, never worked together before, and I had to say to them, we're gonna go through forming, storming, and norming in like 20 minutes, okay? Because then we got to be performing. And the group knew it, and they did it, and it was remarkable. Concept of operations. Mark Sullivan gave us a high-level concept of operations, and very quickly as a team, we had to develop that concept of operations. The decision was made to zone the hospital. Easier said than done. We had to determine the new patient flow. We had to identify new critical care units. We converted all kinds of spaces into critical care units. We had to get the equipment to create critical care beds. IT, working with logistics. IT, working with nursing staff. We had to do patient flow. We had to figure out our PPE supplies. We had to figure out, how are we going to take care of our staff? Now we've reconfigured this whole hospital, and we have these zones, and how are we going to manage this? We want people coming in the hospital, changing their clothes. We had to bring in lockers. We put in lockers all over the place. So there was a lot of details in that concept of operations, and how to get from a hospital that's a regular hospital with an ER to this zoned facility with me, oh, by the way, running around with a curtain rod, keeping people at 6 foot distance. People thought I was crazy. And then talking to people overhead, because I needed, as our keynote speaker said, communication is so important, but there just wasn't enough time for it. And so trying to maintain the communication. So mission clarity, teamwork, developing that concept of operation, and getting to work. So the team would come together in the morning. We would do a quick round robin, very quick, trying to say, where are you today? What are your biggest needs? Where's the next one today? What are our choke points? What are our problems? Who do we need in the room? Who's in the room right now that we can solve a problem right now? Or what's a problem that we can't solve right now, but who needs to be in on that? This was our key team. So that was a lot of coordination. And so we'd meet for about an hour, sometimes an hour and a half. And then we'd break, and it was just amazing to watch the room reconfigure as people got to work. And then we would reconvene in the afternoon. We opened, mind you, we closed the ER on a Saturday. We started work really on Monday. We opened for business on Thursday. Tremendous amount of work. The staff, the communication to the staff probably could have been better. I will acknowledge that, but we were pressing hard and preparing. So afterwards, I really began to emphasize even more so the communication to the staff, and it was a big deal, because then you have to pay attention to the staff. So mission clarity, unified team, concept of operations, and then the leadership sprinkles. And so the leadership sprinkles from my mind are the things that I contributed. The team did all the heavy lift, all the hard work. But again, we were a team, and then there were teams within the team. They were going off to lead teams. The leadership sprinkles are about facilitating, about orchestrating, about, for me, staying high so I could see 14 people, what 14 people were doing, and try to connect dots where dots were connected, talk to our headquarters, who in turn were talking to our keynote speaker. So how do I manage that information and try to protect my team and integrate my team? That was a big effort. I had to listen. I had to listen to them. I had to listen to what their problems were, because sometimes their problems weren't what they thought their problems were. And sometimes there was friction, and I had to break through that friction. That was my responsibility to pay attention to that. And then it was my responsibility to really pay attention to encourage them to communicate to the people. I would say every person in this building is represented by somebody in this room, and we have to get to those people. So that was real important to me. We didn't get it perfect, but we worked real hard at it. So in sum, I would say my job, a military phrase again, is C4, and what the whole team did. C4, communicate, coordinate, collaborate, and compromise. So with that, that's an introduction just to how we got to opening our facility. And with that, I'll turn it back to the moderators. Thanks very much.
Thank you, Rear Admiral McCormick-Boyle. Good evening. My name is Kelsey McIntyre, and I am a second-year medical student at the Jacobs School. Tonight, I am honored to introduce Dr. Ashley Jeanlus. Jeanlus is a fourth-year obstetrics and gynecology resident at the University at Buffalo. Prior to coming to UB, Dr. Jeanlus received her undergraduate degree from Cornell University and her medical degree from Commonwealth Medical School. Dr. Jeanlus recently organized the White Coats for Black Lives March of Solidarity on June 5th in Buffalo. More than 250 medical students, residents, faculty and staff, and other healthcare workers attended the march, which began on Main Street at the Jacobs School and ended in Niagara Square, where marchers knelt in silence for 8 minutes and 46 seconds, the time George Floyd was held on the ground. Dr. Jeanlus had led movements such as White Coats for Black Lives before her time in Buffalo. As a medical student, Jeanlus organized demonstrations in response to the killing of Eric Gardner at the hands of New York City police in 2014. Jeanlus has a passion for encouraging her healthcare colleagues to address racism and combating racial injustices and health inequities in our community. Her mission is inspiring change and empowering all who know her. We are thankful for Dr. Ashley Jeanlus spending her evening with us. Please welcome Dr. Ashley Jeanlus.
Oh, hi, everyone. I have a PowerPoint. Can someone just make me a co-host? Can everyone see it? All right, perfect. So thank you guys for inviting me. It's really an honor to be here, especially after those two speakers. I'm like a little resident, but I am a fourth year resident OBGYN here at the University of Buffalo. And I want to take the time to talk about a protest that led here in June, White Coats for Black Lives, and also talk about some of the inequalities in medicine and what we can do to help combat that. So I think it's really important for us to talk about and have a definition to serve as our foundation before continuing this discussion. So racism is one of the major causes of health problems in the United States. Between 1970 and 2004, the Black-white mortality gap resulted in more than 2.7 million excess Black deaths, making racism a more potent killer than prostate, breast, or colon cancer. As it is widely documented, Black and Latino patients are less likely to receive the care that they need, including adequate pain control, cancer screening, and organ transplants. And there's a variety of reasons as to the cause of this, but within our healthcare system that we can control, there is a bias within physicians and also in terms of the healthcare payment structure for the care of people of color. Clinicians are paid less to care for patients who are underinsured, uninsured, or publicly insured. And these patients are disproportionately people of color. And as a consequence, people of color are often denied access to the healthcare that they need. These disparities in access to healthcare exacerbates the harm that social structures and policies cause to the health of people of color. Black and Latino people are disproportionately victimized by police violence, mass incarceration, and poverty. People of color face discrimination in their efforts to access adequate housing, quality education, and meaningful employment. So the harmful effects of institutional and structural racism are endless. And I only have 10 minutes. So I would then refer to, I have two books, Killing the Black Body, Race, Reproduction, and the Meaning of Liberty by Dorothy Roberts. And then also Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to Present. This book was actually published in 2006. And unfortunately, we can continue to add new chapters to it. You can look at recently in ICE centers how hysterectomies are being on patients without their consent. So there's still process to continue and to move on. But to pivot into something that's a little bit more proactive and positive, I really want to take the time to address how and as a healthcare system and as physicians try to address racism and its consequences. And it should really be a central task for American medicine. So physicians, we must work both within and outside the healthcare system to help eliminate inequities in access to and delivery of care. As physicians, we cannot be silent about the injustice we see. We have a duty to speak and support those in the community who we fight for the lives of others, and also we care for our patients. I really wanted to have this white coat for Black Lives in Buffalo to really help support and show support for the Black community that's here in Buffalo. It's really important to take a stand as a community of healthcare professionals to reflect on the systemic racism and violence against Black lives. In fact, when I first planned this, I have to say, I thought it would be like myself and 3 residents. This picture here is just a portion of the OBGYN department that helped support and to have this protest here. And I was really surprised and inspired by how many students, residents, nurses, other healthcare professionals have continued to try to make a difference even afterwards, and have continued to have open conversations of what else as healthcare professionals that we can do to make a difference. Our white coat in itself has immense symbolism for the medical community. It is our uniform, and it joins us together as a community of dedicated medical professionals. When we wear our white coats, it symbolizes professionalism, compassion, trustworthiness. It means that we are placing the interests of our patients above self and providing the best care possible. And I know there's a lot of medical students and other healthcare professional students here. I would highly encourage that you continue to have advocacy as a cornerstone of your education. We have immense privilege and immense opportunities to make a huge difference in people's lives. And I would hope that we continue to do so, and you find other resources and other support members to help you achieve those goals, because it's really important and very feasible with your privilege. In terms of racial justice in our medical education, in our medical care, in our communities, I do have a few ideas. In terms of our medical education, I really believe that we must aggressively recruit, support, and promote Black, Latino, and Native Americans people in medicine to ensure that the physician workforce reflects the diversity of the community that it serves. Additionally, Black and Latino people represent only roughly about 30% of our nation's population, but we make only about 8.5% of the physician workforce. So we need to help increase that number so then the community that we're serving reflects the population that's actually providing them the healthcare that they need. Physicians of color are more likely to provide care for America's underserved communities, and patients of color report higher satisfaction when their doctors share their racial backgrounds. In taking the next steps in racial justice in medical care, hospitals and practices must take action to eliminate the significant impact of implicit racial bias in the care of patients of color. To counteract these subtle forms of racism, institutions must routinely administer implicit association tests to their medical staff to make them cognizant of their unconscious bias, and then train their medical staff to consciously overcome those biases when developing care. Furthermore, hospitals should create formal and informal structures to encourage accountability for incidents that may have involved racism. This can be done by fostering a work environment that makes it safe for colleagues to question each other's biased actions, and by using structured venues such as morbidity and mortality conference to discuss ways that racism may have impact the quality of patient care. And in terms of racial justice in our communities, we as healthcare workers must recognize that our responsibility to our patients goes beyond physical exams, prescriptions, and surgical interventions. We must work to alter socioeconomic and environmental factors, including structural racism that directly affects our patients' health. The manifestations of structural racism are varied and ubiquitous. Addressing them will require joining movements to partner with and take direction from community members who have experienced systemic oppression and are dedicated to working to dismantle it. We will not be able to solve the problems of racism in our society and in our healthcare system without the input of those most affected by it. In working to combat structural racism, physicians must not only listen to people of color in their practices and communities, but also amplify the voices while advocating for equitable social structures. The privileges that healthcare professionals possess within society must provide us with the power that can be used to spearhead policy, to change and to advance racial justice locally and nationally. Using this privilege to advocate for social change is necessary if we are to eliminate illness that is racism. And then, especially, I think I was told not to talk about anything regarding politics. So I would just say that this year, really take the time to vote, like your rights are depending on it. And then today, actually, the New England Journal of Medicine had this editorial, so I would just highly recommend anyone to read it. And that was all that I had to do. So thank you.
Thank you so much to all our speakers. Each one did an incredible job. Thank you so much. We learned a tremendous amount. And I just have to make a comment. Thank you, Dr. Jeanlus. It takes courage to do what you do and to speak about racial justice and racial justice in medicine. So thank you all. Now we have a couple of minutes to take questions. If you have any questions, you can have them in the chat box, and then Jennifer and myself will read those.
Dr. Burstein. Okay, let's try this again. Dr. Burstein, can you hear me? Can anybody hear me?
Now I can.
Yes, we can hear you.
Oh, you can hear me? Okay, great.
Jennifer, could people hear me when I thanked our speakers?
Yes, I mean, I could hear you until the feedback.
Okay.
Started.
Okay, that's great.
So what we're going to do, everyone, is you can submit your questions via the chat box. To make it a little bit easier for hearing purposes, please do not take your microphone off of mute. Just simply use the chat box and let us know what speaker you are trying to ask the question of. But if you are attending that speaker's breakout session, just for the sake of saving time, maybe just ask the question of the speaker you are not attending the breakout session of. But we do have a first question that I apologize if I get the person wrong because it was previously in the chat. I think it was from Dr. Roseanne Berger. Dr. Burstein, what is the relationship with the New York State Department of Health? Are you getting enough support?
You know, it's tough. I think that people at the state health department are trying to help the local health departments, and many times their hands are tied because, you know, this, I mean, I'm not sure how much, you know, you're aware behind the scenes, but really in New York State, you know, just like nationally, and instead of our COVID-19 response, which should be a public health response led by a public health agency, is really being run by elected officials. And so that's true at the federal level. You know, it's true here at the state level. I mean, the governor will come out with, you know, announcements at his press conference with new executive orders, and it's probably the first time like the health department has hears about it. And so then they have to scramble and kind of develop guidance about it. So I think, you know, we're all trying really hard. And I mean, you know, even here at, you know, at the county level, I mean, a lot of the decisions are made by our county executive. I'm really fortunate that he's a smart guy and he understands, you know, he's, you know, after 8 years, you know, he's come a long way with understanding public health, but it's, you know, it's not a typical public health response to a public health problem. If, you know, if you have the opportunity in April, then there was a great article showing the response to COVID-19, you know, comparing Washington State, that the response was led by the state health department, to New York State, where the response was led by the governor's, you know, the governor's office. And so it's just, you know, really interesting just to see the, you know, the different approaches there. So, but yeah, I mean, the state health department, I think, is helping us as much as they can, but it's, you know, it's really complicated. And also there, you know, there are limited resources.
Dr. Burstein, this is another question for you. I'm going to combine two questions that came in. One of them is, how will we reduce fear and follow science to move our schools from virtual learning? That came from Dr. Sue Baldwin. But then Dr. Lucy Mastrandrea also asks, do you have any thoughts on how schools are doing with COVID? So kind of putting them both together there.
Yeah, we've, you know, expended a lot of, you know, time and effort and resources to, you know, work, you know, partner with our schools, our pre-K through grade 12, and then also working with our higher education. So we've, you know, developed our, you know, our own guidance based on the science out there, just to keep people, you know, students and staff safe in the world of COVID-19. And, you know, and I think many students are back in school. I mean, you know, we can't dictate operations of local school districts. So it's really up to the school district whether they decide to offer, you know, in person or, you know, complete virtual. That, you know, that, and I think a lot of that is politics and you know, and unions and you know, those type and resources and those type of issues. And you know, I think you know, we have a solid protocol right now that we've you know, shared and have multiple meetings to explain with our local superintendents to you know, keep as many kids and teachers in school as possible with COVID-19. And we haven't had any huge outbreaks in Erie County. You know, in other counties, they may have had larger outbreaks in schools, but, you know, so far we haven't had any major outbreaks in schools, and we haven't really seen any in-school transmission. So, you know, again, if there's a case, then you know, many times the class will have to be quarantined. So they'll be out of the classroom for 2 weeks. However, there's still like virtual learning opportunities. And again, we're doing this to make sure that there aren't any outbreaks within the schools so the schools can stay open. And I think, so far, so good. Also, the state we're really fortunate. They've given us these 10 Abbott ID Now point of care molecular diagnostic tests that we're using exclusively for students and staff they have to go into the building to either learn or teach for pre-K to 12 for so that if they develop symptoms, hopefully they can get an answer whether they have COVID-19 or not and get back to school as soon as possible. So we're working collaboratively, and hopefully the schools will be able to stay open for until COVID-19 is a vaccine preventable disease.
Thank you so much, Dr. Burstein. There is another question that I see for you, and it says, basically just thanks you for your job, and it was an endearing relationship between you and Paul and Cars.
Yeah, well, Mark's a great boss. He's great. He's great to work for, and he's been like super supportive for public health. I mean, he's really given the health department so many resources. I mean, I can talk about more in this breakout session, but I know when I moved back to Buffalo. I'm a Buffalo native. When I moved back in 2005, I got a job as the medical director of epi and surveillance at the health department, and I think and then Chris Collins was elected, and it was just so awful. Like, so many just like closing so many programs for like no reason, just to shrink government. People were going without health care and public health services, and I'm like, this sucks. Like, I have options. I'm leaving, and so I quit. And I fortunately I had the opportunity to work at then Women and Children's Hospital of Buffalo and University Pediatric Associates, and I worked part-time for CDC at that time too. But and then when and then it's been really refreshing coming back to the health department as a commissioner and having a leadership that has been like super supportive of public health. And again, we have different backgrounds, and I'm always learning about politics from Mark. It's like super interesting, and I think he's come a long way and learned a lot about public health. So I think in general it's been a really nice relationship. I mean, this has been the best job I've ever had.
Thank you so much. Okay, again, thank you to all our speakers. So what we're going to do now is move into the breakout sessions. You will see the link to 3 breakout sessions in a chat box. You can go ahead and click on the one that you would like to join, and then you're going to be redirected to that Zoom and asked to leave this conference Zoom. So you can go ahead and do that right now.